This is Josh Stevens in room 1 on the Blue Medicine team. He's a patient of Dr. Lee. He was admitted 2 days ago for reports of nausea and vomiting, and he was eventually diagnosed with gastritis. Even though we provided education about fall safety and we tried to ensure a safe environment, Josh tripped over a cord while trying to get out of bed last night, and he could not catch himself due to his amputated left arm. He didn't fall completely on the floor, but he landed on his right knee really hard and he injured it. The orthopedic team came and consulted to manage his knee injury. Josh had an MRI taken of his knee last night, and the ortho team said they don't want him to bear any weight on his right leg. So they ordered him to stay on bed rest for the meantime. Josh hasn't been able to move around as independently as he used to, and he's become withdrawn and sad. He's also worried that his new knee injury will prevent him from participating in the playoffs. On top of that, I put the bed alarm on his bed because of his impulsivity, and that made him really mad. The ortho team also placed a bunch of new orders, so you should take a look at those. Anyway, Josh originally came in after experiencing 7 out of 10 burning pain in his upper abdomen. He said he had been drinking a lot since losing his job 4 months ago. So he's been under a lot of stress. What else can I say? Oh, he has a past medical history of wisdom tooth extraction in 2012 and a left upper extremity amputation due to a bicycle accident in 2002. He has no known drug allergies and is ordered for full code status. So he's alert and oriented ×3. All his neurovascular checks are fine. Even though he injured his knee, his foot seems to have no numbness or tingling. Anyway, he's definitely been withdrawn and sad. I'm worried that maybe he's a little depressed because of everything. Cardiac-wise, he has regular S1, S2 heart sounds. His blood pressure's been the same. All of his pulses are palpable, especially that one in his right. The ones in his right foot. Respiratory, he's been maintaining an O2 sat fine on room air. He doesn't wear oxygen, and his lung sounds are clear. So GI, luckily he isn't vomiting anymore. He is a little bit nauseous here and there, and when I palpated his stomach, he said that it was tender. He did have a bowel movement last night, and I know the doctors wanted to track the consistency and color. I didn't notice any really dark stools, so I guess that's a good thing. For GU, he voids independently in the urinal, and he leaves it on his bedside table. So musculoskeletal, like I said, the doctors don't want him getting up out of bed. So I've just been leaving his right leg kind of alone. For skin, I haven't noticed any skin issues. His turgor is fine. For lines, he has a peripheral IV in his left arm. His labs have remained pretty much the same. He's on a couple of continuous IV medications, so you should take a look at your MAR to figure those out. For pain, he does tell me he has some burning pain in his stomach still, so I've been trying to support him with that. His last set of vitals are in the chart. There are no new test results. Again, for psychosocial, he seems a little depressed to me. So maybe take a look at the new orders. I haven't really had time to look at them yet. I think they ordered some new medications as well. Maybe you can try to cheer Josh up. I tried to explain to him why I keep waking him up to turn him and why I put the bed alarm on, but he doesn't really want to listen. Maybe you can try educating him.